The Community Needs and Resource Assessment Preliminary Report, February 22, 2018. The Community Action Partnership of North Alabama conducts a formal Community Needs and Resource Assessment every 3 years as directed by CSBG organizational standards. The Community Needs and Resource Assessment is conducted by collecting data from our communities to determine the top 6 needs of individuals, families, and communities. The input of experienced community members reveals where services are utilized and where service gaps exist. It identifies the most valuable community resources and ultimately guides the strategic planning of the agency. The Community Needs and Resource Assessment Committee included the following staff members from the partnership: Michael Tubbs, Cindy Anderson, Jennifer Carroll, Nathan Curry, Holly Hicks, Stephanie Johnson, Amber Jones, Laurie Lincoln Swaim, Lori Morrow, and Allison Spiegel. The Community Needs and Resource Committee began meeting in March of 2017. They set the stage for the Community Needs and Resource Assessment by developing an understanding of the purpose and goals of the Community Needs and Resource Assessment, by reflecting on the 2014 Community Needs Assessment, determining the outcomes of the process, identifying the process components, and designing the process instruments such as surveys, focus groups, data sources, and crafting the proposed timeline. Instrument designs focused on components that included family and community needs and most valuable resources available to families and communities. The committee developed a process of the Community Needs and Resource Assessment as a collective effort involving a cross-section of key staff, input from the board, community partners, Roma trainers, and others, full use of the Roma cycle, survey sampling that provided a valid sample of the community, publicly available community-level data collected, acquisition of partner community needs assessments for process validity and overall insight, resources and guidance from the National Community Action Partnership, and a realistic timeline. The Community Needs and Resource Assessment targeted 3 audiences. Partners. The committee defined partners as individuals, organizations, and businesses with whom we collaborate or have a referral relationship. Community members. The committee identified community members to include the following sectors: education institutions, community-based organizations, faith-based organizations, plus private sector and public sector entities. Clients. Individuals and families who have been served through one or more of our agency's programs. 2 survey instruments were designed for distribution, one for community members in the 16-county service area and one for partners and businesses throughout the 16-county service area. A Spanish version of the community survey was created. The committee's initial methodology was agreed upon as 25 partner surveys per county and 100 community surveys per county. While the 3 core county community survey methodology remained the same, due to the lower than expected participation levels, the community survey methodology was updated for the 13-county extended service area, reducing the number of 100 surveys down to 25. In this report, the survey areas are defined as the entire 16-county service area, the core area counties, which are the 3 CSBG counties, and the extended area counties, which are the remaining 13 counties. Surveying of both partner agencies and communities ended on Friday, August 11, 2017. The top 6 needs from the survey were shared with the board at the Thursday, August 24, 2017 board meeting. The survey design identified top needs and specific focus areas within the need. The need of child care for infants, toddlers, and preschoolers. Food, soup kitchens, food pantries, and food programs for all ages, children through senior citizens. Health care, dental, physical, and prescription assistance for all ages, children through senior citizens. Housing, safe and affordable rental, home repair, weatherization, and home ownership. Jobs for youth, older adults, ages 55 and up, and formerly incarcerated. Utilities, electric, propane, and natural gas for all individuals and families. The survey included community resources selected with the input of non-committee agency staff, combined with a report of most frequently referred resources through 211 Information and Referral System. The inclusion of the resources in the surveys gives insight on who the community turns to for assistance most often and who they highly value. Knowing these resources validates the current partnerships and determines the potential of new agency partners. The Community Needs and Resource Assessment Committee, in partnership with representatives of the Board of Directors, came together to form a focus group committee. The goal of the focus group committee was to take the 6 needs from the survey and look into the causes and conditions behind those needs. It was determined that 2 focus groups in each of the 3 core CSBG counties, Cullman, Lawrence, and Morgan, would take place. One focus group would target partner and community feedback, and the other group would target clients with a focus on Head Start parents and guardians. The focus groups in the remaining 13 counties would be scheduled to take place in the 2 years between the 2017 Community Needs and Resource Assessment and the 2020 Community Needs and Resource Assessment. The Cullman County Partnering Community Focus Group met at the Sarah's Ridge Apartment Complex. The Client Focus Group gathered at the Garden City Head Start Center. The Lawrence County Partnering Community Focus Group met at the Alexander Terrace Apartment Complex. The Client Focus Group was held at the Moulton Head Start Center. The Morgan County Partnering Community Focus Group was held at the United Way of Morgan County, and the Client Focus Group was held at the Decatur City Head Start facility. The community responded well to these focus groups, and rich information regarding the causes and conditions of the 6 family and community needs was gained. Morgan County Focus Group results identified causes and conditions behind the 6 needs. Among those are child care costs are too expensive, lack of variety of food through food banks and pantries, lack of health care benefits offered with jobs, limited affordable housing options, lack of community resources for job training programs, and financial burdens prevent the payment of utility bills. Lawrence County Focus Group results show that causes and conditions include lack of child care options, food needs of the family exceed what is offered, health care cost is unaffordable, lack of skilled or honest labor for home repairs, limited educational support for job skills and jobs, and utility bills are higher because the home is not energy efficient. Cullman County Focus Group causes and conditions include child care hours of operation are limited. The community lacks knowledge of community food resources. There is a lack of health care resources and access to those resources. Limited affordable housing options. Personal barriers limit job attainment or job retention. and a lack of options to pay utility bills. The Community Needs and Resource Assessment identified the most valuable resources from the community's perspective, the top 6 individual, family, and community needs, and the causes and conditions behind the top 6 needs. The key findings were validated through community-level poverty data for the service areas. Let's take a look more closely at this information. 6 key areas of need. Child care with a focus on infants, toddlers, and preschoolers. Causes and conditions, as outlined by the community, are that costs are too expensive for families, communities lack resource options, and the community child care operation hours are not conducive with real-life work hours. The 16-county service area of the Community Action Partnership of North Alabama reports 27% of children are living in poverty, and 12% of those children are living in extreme poverty. The state average is also 27% of children living in poverty, but is slightly higher at 13% living in extreme poverty. Just over 50% of the mothers in the 16-county service area with children ages 0 to 5 are employed. The state average is 60% of mothers with children in the same ages. The Community Action Partnership of North Alabama currently provides child care for infants, toddlers, and preschoolers at no cost to those meeting eligibility requirements in communities with limited child care options for low-income families. The Community Action Partnership does not currently offer extended hours of operation, but due to this issue area, may consider extended hours of operation in its service area in the future. 6 key areas of need. Food. Focus. Soup kitchens, food pantries, and food programs for all ages, children through seniors. Causes and conditions as reported by the community. Families lack knowledge of community resources. Communities lack food assistance options. Community food assistance programs do not provide a variety of food choices. Alabama's low-income household population with low food access is 22%, as compared to 19% for the U.S. Of the children in the 16-county service area living in poverty, 10% have limited access to food, and 16% of the seniors age 65 plus have limited food access. The Community Action Partnership of North Alabama programs such as Meals on Wheels and More, Head Start, and Foster Grandparents offer one or more balanced, nutritious meal Monday through Friday to low-income children, adults, and seniors at no cost to the recipients. This provision helps to ease the burden of food costs for those low-income recipients and provides needed nutritious food for those most vulnerable. The Community Action Partnership may consider partnering with organizations with established food assistance programs to offer a larger variety of food choices and to extend the organization's scope to reach more individuals and families in need. 6 key areas of need. Health care, with a focus on dental, physical, and prescription assistance for all age groups, children through seniors. Causes and conditions as determined by the community. Jobs in the community do not offer health benefits. Health care costs are too expensive for families. Communities lack health care options. And government health care programs have strict requirements. Statistical poverty data. The majority of the 16-county service area has a population of 26% or greater living below 200% poverty level. All counties in the 16-county coverage area except for Madison County report a shortage of primary care health professionals. The Community Action Partnership of North Alabama partners with 2 health clinics to provide physical, prescription, and dental care for low-income eligible residents in 2 of the 3 core counties. These partnerships have proven successful, and the Community Action Partnership may consider additional partnerships to address this key area of need. 6 key areas of need. Housing, with a focus on safe and affordable rental housing, home repair, weatherization, and home ownership. Causes and conditions as determined by the community. Communities have limited affordable housing options. Communities lack skilled or honest labor for home repairs. Home repair costs are too expensive for individuals and families. The Community Commons reports that 21 to 35% of the households in the 16-county service area have housing costs that exceed 30% of the household's income, with 22 to 34% of that housing stock considered to be substandard. The Community Action Partnership of North Alabama provides weatherization assistance to qualifying low-income homeowners with the goal of decreasing utility costs and maintaining safe, quality housing. Additionally, the partnership is a NeighborWorks affiliate partnering with stakeholders to develop energy-efficient, safe, affordable, multifamily, and senior housing across the state of Alabama. Currently, the partnership has developed 593 housing units across the 16-county service area, with an additional 56-unit multifamily housing project to be finished by the close of 2018. The partnership is a lead entity in affordable housing in the state of Alabama, with a passion to continue to address this key area of need for communities and families. 6 key areas of need. Jobs, with a focus on youth, older adults, and formerly incarcerated. Causes and conditions as determined by the community. Communities lack job options. Community resources are needed to bolster training programs and job attainment. Formerly incarcerated individuals experience obstacles transitioning into the workforce. According to the Bureau of Labor Statistics, the unemployment rate for the 16-county service area is 5.4%, which is greater than both the state and the national unemployment rates. The Community Action Partnership of North Alabama partners with community organizations to increase their capacity to offer job skills and training programs for formerly incarcerated adults and at-risk youth. These programs may pave the way for adults and youth to be successful in securing stable, long-term employment and fulfill the mission of the partnership to reduce or eliminate the causes and consequences of poverty. The partnership may consider collaborations with other successful organizations to fund additional resources to increase the impact of efforts to address this key need. 6 key areas of need. Utilities, with a focus on electric, propane, and natural gas. Causes and conditions, as determined by the community. Family financial burdens prevent them from paying utility bills. Communities lack assistance options. Statistical poverty data. The 16-county service area population that is below the 200% poverty level is 39%. The Alabama population below 200% poverty level is 40%. Significantly over the United States rate of 34%. The Community Action Partnership of North Alabama administers the Low-Income Energy Assistance Program, LAHEAP, and partners with community stakeholders to supplement other energy assistance efforts through programs such as Operation Warm, Operation Share, and the Alabama Business Charitable Trust Fund. The partnership's HUD housing counselors are in a unique position to offer an array of financial capabilities counseling, which includes budgeting and energy conservation measures to support individuals and families in their quest to address financial burdens that may prevent them from paying utility bills. These services are designed to intervene in situations where utility issues exist and stabilize the individual or family. As we conclude our Community Needs and Resource Assessment, the committee makes the following recommendations. Key findings for 6 needs, causes, and conditions serve as a framework for the agency's strategic plan. Key findings for 6 needs serve as a basis for all program and initiative work plans. Increase collaboration among the most valued community resources for the program and initiative work plans.